Every year, thousands of people and workers are at risk of dying early from occupational and environmental diseases. Some become sick, and some even lost their organ through diseases and accidents like to their work. These illnesses and deaths are highly preventable if workers are informed the codes of safety practices and use protective equipment properly. Department of Disease Control, as an agency to protect people from diseases and health hazards, recognize the importance of this issue and, therefore, established the Bureau of Occupational and Environmental Diseases to promote safety and protect health of workers and people from occupational and environmental illnesses. Occupational and environmental diseases was spot from 1964, when there were 41 cases of manganese toxicity in battery factory. This incident was a significant trigger that turned health administrators to focus on occupational health and safety. In 1966, Occupational Health Project was put into the second National Economic and Social Development Plan. Occupational health was first operated in 1967 as a health project and then as a division of occupational health under Department of Health Promotion, which was later renamed as Department of Health. In 2002, Division of Occupational Health was transferred to be the Bureau of Occupational and Environmental Diseases under Department of Disease Control. Since 2002, Bureau of Occupational and Environmental Diseases began operating proactively as its defined vision to be a national leadership in academic and technology department of disease and health hazard surveillance, as well as prevention and control of occupational and environmental diseases. Occupational Health Group is responsible for conducting studies, researches, and knowledge development to formulate guidelines and measures for prevention and control of occupational health hazards and diseases. This group also has responsibilities to develop and support health services at all levels, as well as to coordinate health and non-health stakeholders to be participated in work-related disease prevention and control activities. Environmental Medicine Group has a responsibility to develop standards, guidelines, bodies of knowledge and support policy related to environmental disease prevention and control. This group also has a role to coordinate and support health services at all levels, to set up and provide environmental health services in order to take care of people affected by environmental hazards. Intelligence and Emergency Response Group has a role to develop and disseminate the accurate occupational and environmental data and information in order to immediately respond and alert to every occupational and environmental incidences. Reference Laboratory and Toxicology Center has a responsibility for the development of diagnostic technology in order to deliver timely services and comply with international standards such as ISO/IEC 17025. Occupational Health Service Development Center, Samut Prakan Province, has a role to promote and develop occupational health services in government and non-government health service system at all levels by focusing on quality evaluation and control to comply with the required standards. Occupational and Environmental Health Development Center, Rayong Province, has a function as a comprehensive academic and research development center of toxic chemicals in Asia. This center has a responsibility to set biological standards, biological exposure indices, and other reference levels to develop relevant safety standards, policy, and regulation, as well as to disseminate training programs in toxicology for prevention and control disease related to toxic chemicals. General Administrative Group is responsible for all administrative functions. Major parts of tasks involve providing services to employees with service mind and accountability, and ensure to coordinate and support all organization activities. Strategic Group has a role in driving strategic by collaboration with network partners and formulating effective action plans and projects. Additionally, this group also focuses on project monitoring and evaluation in order to ensure sustainable development. Organization Development Group has a function to promote, support, and develop capacity building of employee with moral and ethic principle, as well as to build a healthy and happy working environment. Public Communication and Network Potential Development Group has a role to develop and deliver key communication of occupational and environmental disease to the public by using effective and standard public relation processes with appropriate channels. The role of this group also involves the coordination, supporting, and development of network partners to disseminate important message to relevant organizations. With our firm commitment to promote health and well-being of people, Bureau of Occupational and Environmental Diseases aims to develop our organization to be an excellent center of work and environmental disease prevention and control that comply with the international standard. By working in collaboration with other member countries, we commit to continually support and develop a concrete and sustainable occupational and environmental disease prevention and control at the national and further at the regional level.